Good morning and welcome to week 2. We're going to go ahead and start navigating through the PowerPoint. That way I can give you any additional information or examples of what I mean through the PowerPoint presentation, as well as let you know important things to keep note of for future quizzes and assignments. So we're going to start talking about patient relations as I'm going to follow through the PowerPoint that you are looking at as well. So this is, it's pretty big in a dental office because a lot of people are very nervous most of the time, and that's not really exactly their favorite place to be. So it's part of all of our roles to have empathy, concern, and understanding, and to be warm with each and every patient. So all of these emotions are how we demonstrate how we communicate with our patients, and it is a service that we provide to make the environment as calming as possible. I know you're going to be going into different offices and you might not specifically be in general practice, which is what I practice in, but in pedo, ortho, all of those areas, patients do get very, very nervous just being there alone. So it's something that's really important for everyone's role in the office to know how to communicate with their patients. So this goes as far as answering any questions they may have. A lot of times they're taking in a lot of information that's given to them by the doctor, so they might have additional questions. And it is very important to know that when they are being offered treatment, that the patient is of the understanding that is not something that we are making them do. This is something that's 100% their choice to make, and that we respect that, and that we even if we don't agree, we let the patient know this is very serious, this is what's going on, this is what you need. The patient may say, that's too costly, or that's not something that I'm prepared to do right now. We have to respect their decision, even if we don't agree with it. So that's something that is really important. The patient's first impression is going to be a huge factor in the dental office. So if we are working front office, sometimes you're the first person that they talk to. So answering the phone politely and answering any specific concerns, make sure we're pleasant with everybody is really big, because that's going to be their first impression of your practice, is of the person that answers the phone. So you have to make sure that they're given our full attention, and that they know, we're not trying to rush them off the phone, even though it may be very, very busy. It's very important that they feel heard, and that their time is important just as much as our time is important. So I'll make sure to use our pleasant voice, and that we get all of their information, and that we give them our time of day. So a lot of things, that's something that I practice that sounds a little bit funny, but I smile when I'm talking to someone on the phone, because they can sense the happiness. They don't see your smile when you're on the phone, but you can feel it. You can feel the warmth. So I will do that a lot, is I will smile as I would to a person in person while I'm talking on the phone. So this is as little as making sure the reception area looks tidy and clean. Everything appears clean and organized, and there's patients do come in and leave things all over the place. Make sure somebody is constantly checking to make sure that our appearance to the patient is going to be a good first impression. So they got somebody on the phone, they're seeing the first patient that they meet when they walk in, whoever that may be, and that the area looks secure and clean. Another big thing that I've heard from patients is that they're immediately asked, like, they don't even, the person on the phone's not even asking them why they're calling. The first question they want to know is if they have an insurance or not. So that is a question that I do not ask up front, because I don't want them to think that that's the only, dependent on if they have insurance or not, that we're going to treat them differently. So it's very important that, we get to address their concern before we start to ask for more detailed information from them. There are going to be problem patients that don't want to follow through with what they're teaching them, because this may be the first time they've ever gone to the dentist before, or, they've just never maybe properly got information, or they were forced to do a lot of things that they weren't ready to do. So, it might be a little overwhelming for patients first coming into your office. And we want to make sure that, change is hard for everybody, us included. And we want to start, and if they are changing their dental habits to make themselves better, that we start with the very small goals and, a few tools first, let them master those things and then add on top of there. So it's very, very important that to help them follow through and stay compliant with what we want them to do for their health, that they start small. Especially with complaints, we want to make sure that we don't ignore what's going on with them, that we allow them the time to voice their concern and not cut them off. Even though if it's completely not your fault or a little bit over the top what's going on, they're uncomfortable for a reason. So we want to make sure that they do feel heard, because a nice, understanding voice, whether we agree with them or not, is going to come with a better result. If we meet their attitude with your attitude, they're not going to be likely to listen to what you have to say. So, they might say, I'm leaving, I'm never coming back here again. I make sure no matter what the patient says and what their complaint is, that they leave with a courteous, calm understanding on my part, because that's all we can do is our best, right? I mean, we're not going to make 100% of everybody happy, but we can strive to, and it could be a goal. So we might not be able to get everybody's, needs met. However, we can be kind, we can be courteous, and we can be as positive as we can be. And then sometimes that leaves a lasting impression. We have angry patients that they're the most important person in the world, and we must make them feel that way, that, we are available to listen. We will make sure that they feel like they're, our focus, even though, we have a lot of other patients. And sometimes in the heat of the moment, the patient's angry, but they might think about it later when they calm down, that you were there for them and you were kind and you were courteous, and maybe they're just having a bad day. Moving down to team communication, we want to make sure that everybody on the team is being delivered the same message. So, we don't want the patient get mixed messages. So it's a very good idea to have certain scripts for common questions that patients may ask. That way, whether the front office, the hygienist, the doctor, the assistant, everybody is telling the same message across the board. Very important, with body language in the dental office. Sometimes we get in there, we start working, we see something a lot bigger that wasn't there before, or something, much grosser than what we were expecting. So we make sure that the eyes and our personal body language, because since we have our masks on, all you see is our eyes. So we want to make sure that doesn't surprise them, or they don't see everything written on our face. And that we just always stay positive and speak clearly, and make sure to, they don't know a lot of dental words. So make sure that we make it simple for them to understand. So a lot of these scripts that I'm speaking of, and making sure that we have the same message. A lot of things should be in a procedure office manual that a manual that every office should have. It should have, has your views of the office, the rules, the regulations, and what should be expected from each team member. So later on in the semester, we will be working on our own. So we'll tap into that in more detail. So as you can tell, working in an office with even a lot of people, or even a small private office with not as many people, there can be conflicts between team members. So these are a few definitions that you'll want to just be familiar with, just so that you can tell the difference between the two. The first one's going to be intrapersonal conflict, so conflict with yourself. You might have had really high goals. Maybe you're not meeting those goals to your own expectations, and maybe you believe that you had a duty to do something specific and you didn't do it. Or for example, this can happen a lot as well working in a big team, is that you're to be there to support one another. You have to be there to be a team player. And a lot of that is being able have the ability to do whatever is being asked of you or volunteering to help. So for example, you would have an interpersonal conflict if, say, you are an office manager and, something isn't tidy in the waiting room, let's say, but let's say that's not your responsibility. Even if you feel that that is below your personal responsibility, it's important to help out and to volunteer and to be there for your team, because maybe it's not your responsibility to clean the waiting room. However, it needs to be taken care of, and maybe you're the only person that's available to take care of it at that time. You don't want to seem that there are duties that are below what you believe is to do. It's just, you want to be there. I've personally have jumped in and because I am an RDA, I've jumped in and assisted. That's not my main job duty as an office manager. But if we need help or somebody calls in sick or, we're falling behind, if my hand can help out in the back, I don't believe that that is not my job. I jump in, I clean instruments, which again, not typically my job duty, but I'll do it if we're falling behind to get the schedule moving, because what's going to help the entire team will help you as well with the flow of of that. So there's a few definitions here I want you to read and to go into a little bit of detail on what the differences are between those conflicts. And then these are a few other definitions on slide 6, talking about how to handle those conflicts and styles. So again, some definitions to just be familiar with and make sure that you read through. So as we talked about before, we were talking about body language, which is a form of nonverbal communication. So you'll want to know the difference between verbal and nonverbal. So nonverbal is a way of communication. That is your body language, your facial expressions. Even if you're wearing a mask, you can tell when you smile, your eyes open up and, your eyebrows raise. If you're frowning, you can see that in your face, as well as, your tone of voice, making eye contact with patients, being really sincere. They can read that all over your face, even with a mask on. So we want to make sure that they are getting that calm, nice, positive environment, and that we are giving them eye contact, because that is them knowing that we're paying attention to them. So patients may give you nonverbal communications in the dental chair. They might squeeze their hands really tightly and you see that their knuckles are getting white, or they're clenching, down on a chair, squeezing, and they might be even doing it like involuntarily, but you want to make sure that we're reading those cues and we're keeping them calm. We're going to move into staff meetings. These are very, very important. They can seem laborious, but they're very, very important to have staff meetings. So they serve different functions. So there can be formal and informal meetings. A formal meeting would just be, you know about it ahead of time. It's very structured. You have a goal in place. Informal meetings can be you go out for a meal and openly discuss some items, or you do a walking meeting, which means the whole team goes on for a walk. That's more informal and more loosely based. But if you are gonna have a meeting, you want to make sure that it is constructive, meaning there's a purpose. Even if it's informal, there has to be a purpose to have the meeting. You have to have something that you're going to be discussing. And sometimes having an open informal meeting brings up other items as well. So this is a very effective tool to communicate problem solving. It gives everybody a voice, one place to communicate, but you shouldn't have meetings only when there's a problem, because you don't want it to have a bad stigma that you're having every single time you have a meeting, something bad is going to happen. So that's why it's good to have regular meetings, monthly or scheduled, to your schedule. That way you're going over important topics, but also there may be issues that come about. So the duration of the meeting just dependent on what the purpose is and what you have to say. So you want to make sure it's best to have a standard set meeting. So for example, I do a monthly meeting with my staff, and I do it for 2 hours once a month. There's also short meetings called morning huddles. And so this is something that you'll want to write down or highlight. I think I have it highlighted right there on the PowerPoint, to remember what the morning huddle is. And this is the meeting that is about 10 to 15 minutes, depending on the practice. And it happens at the beginning of the day, and it's to go over that day's schedule. So you want to be prepared for the day, talk about potential difficult patients that you may have. And I don't mean not just personality difficult, but maybe they're a little bit tougher. They need some extra attention, extra TLC, specialized things that you wouldn't normally use with another patient. So for example, I have a patient that needs a special neck pillow that we do have in our office. We have special neck pillows for older patients or patients that have neck and back issues. Or for example, if it's a larger treatment, we have weighted blankets and things like that. So this is a time to go over the schedule, to talk about anything that has to do with the patients that you're going to be seeing that day. Or for example, if somebody's family member passed away, you want to be there for them, but then not also ask them how that family member is. You want to make sure the whole team is aware that they have had that loss of a spouse or a child or something like that, and you're not asking how that person is, because it's going to make them very upset. So that's, this is why we have these meetings. And I at my office, we have them every day, and something comes up every single day with somebody that needs something, or there needs to be extra attention to there. And two, you're talking about your workflow as well. So before a meeting, you want to identify why the meeting is being held. What are your goals? So you want to have a written agenda of what's going to be spoken about, what your goal is. These are some key items that you'll want to highlight as well. We are going to have an appointment facilitator, a note taker, and a timekeeper. So if you move on to slide 10, it will let you know what is done with that. So for example, the facilitator is somebody that keeps the flow moving. So you might be talking about a problem, or you might be talking about even something fun or interesting that it might go too long, because you have to keep it going, or else you're going to run out of time and you're going to miss important things that you have listed at the end of the meeting. So it is a best practice to talk about the most important topics in the beginning to give it that extra time. So there's some definitions on there. And then after the meeting is over, the note taker will type up the notes and make sure that everybody gets a copy. So what I do is I print out my agenda, I hand it out to every single one of my team members, and then I take the notes from the note taker, I type it all up, and I keep it in a digital file, because everybody should be taking their own notes as well of what you took from the meeting, but at the same time there has to be a copy of record of that, and I keep that digitally so that way anybody can go on the computer and look at that at any time. So please go through the PowerPoint, make sure you got all the topics on there, and hopefully you're able to use this video for a little bit extra meaning. And of course, let me know if you have any questions regarding this chapter. So please move along through the modules, and you're going to be submitting a text response on your takeaway of this PowerPoint presentation. So I hope you have a great rest of your week.